8,660 test results received today. That takes the total to 4,158,568 tests since the beginning of the pandemic. Can I just again thank each of those more than 18,600 people who were tested yesterday and got their results back today. That's a very, very strong number for any day on the weekend, and particularly Sunday with such good weather. So we thank everyone who's gone and got tested. That really is the most important thing you can do for your family and for every family, and for us to be on top of any cases that might be out there in the Victorian community. We often make the point about getting tested, and whilst the vast majority of those results are negative, you've got to have testing numbers that are high enough that you've got confidence that you've got a broad enough picture, a big enough sample if you like, to know that we don't have the virus in our Victorian community. Now, I've got a couple of announcements to make in relation to a new common sense traffic light system, which would see every part of the country coded either red, orange or green for the purposes of travel into our state. It also serves as advice for any Victorian travelling to other parts of the country. This is based on public health advice, and it gives to our public health team and indeed every single Victorian clarity and certainty about what the status of every other part of our nation is. I'm very pleased to be able to say that regional New South Wales from 5:59 p.m. tonight will become orange, so we'll move out of the red zone, and therefore people from Victoria who want to travel home from those areas, and you've got the list in front of you, will be able to do so. Greater Sydney remains red, and we will update that daily and continue to make further judgments, our public health team, and they'll provide advice at the appropriate time when that can become orange and indeed green at some point in the future. In terms of Brisbane, whilst the restrictions that have been imposed in Greater Brisbane come off at 6 p.m. tonight, the public health team is still not 100% confident that we can have people from Brisbane returning to Victoria, so we will again monitor that each day. There's still many close contacts that have not been tested. It's a relatively new outbreak. We're very pleased, of course, for our friends in Queensland with such positive results over the course of the weekend. Many tests and no additional cases, but the public health team are not yet, in Victoria that is, are not yet comfortable to have people from the Greater Brisbane area coming back to Melbourne or travelling to Melbourne regardless of where they might live. Again, that'll be updated daily. So later in the week, we hope to be able to have more to say about Sydney and Brisbane. I want to thank particularly all of those people who are very patiently waiting until the public health advice allows us to have those people return home. We know this is a deeply inconvenient, very challenging time for you, but there really is no alternative but to follow the best of public health advice and make sure that we do nothing, any of us, do absolutely nothing to jeopardise the very precious thing that we've built here. Such low case numbers, having defeated the second wave, we all know how quickly this virus moves, and particularly this UK strain. So it's very important that we follow that public health advice. That's what we've always done, and it's what we intend to continue to do. So from 6 p.m. tonight, anyone wanting to come to Victoria will need to apply for a permit. The Services Victoria website will be the place to go. You can get a permit, and it will be based on the colour code, that is to say the virus status of where you've been, the virus status of where you're coming from. Very simple, very easy, and what that will mean is that we can provide clarity to people who are wanting to travel here, and we can also make sure that we're as consistent as possible when it comes to those areas where you would be issued a permit, a green zone or an orange zone, and of course those that you would not be getting a permit from being a red zone. There are substantial fines, a new penalty just under $5,000 if you turn up here without a permit, or if you turn up here and you should not be here if you've not bothered to apply for one, or if you were rejected and then turned up, then you face that $5,000 fine. That is significant because we don't want a situation where people are not playing their part. Everybody has to play a part in this. Now, to speak in more detail about public health advice, particularly in relation to Sydney and also Brisbane, I'll now throw to the Chief Health Officer, and I want to come back and then just say a couple of things about total fire ban and some very significant fire danger today. No fire activity that I've been briefed on, but It's a very dangerous day today, and we just want people to be cautious, both in terms of the heat, but also knowing and understanding the circumstances where you're heading. A lot of people will be out and about, holidaying, visiting loved ones, doing all the usual summer things. We do have a total fire ban in some parts of the state and extreme conditions in others. I now ask Brett to add to my comments, and then we're happy to take any questions you have.
Thanks, Premier, and good afternoon. So obviously the situation in regional New South Wales has improved and looks good currently. My assessment is really based on the fact there are no active cases in regional New South Wales. That includes Central Coast. There's been one transient low positive detection in wastewater in Ulladulla, but all other regional areas of New South Wales haven't had positive wastewater detections. And the exposures that have been in Eden and Bermagui haven't led to cases. They were late in December last year, and the more recent exposures, including in Broken Hill, have been more than 7 days ago, and again haven't led to further cases. And in fact, the co-traveller for the person who went to those exposure sites has remained negative, so the individual is likely to have been negligibly infectious or very low in terms of infectiousness. So they're all positives for regional New South Wales, and that's why it's going to have a determination of being an orange zone from 5:59 p.m. tonight. In terms of Greater Sydney, again, the trend is positive, but there are ongoing cases, there are ongoing new exposure sites, ongoing transmission for the Greater Sydney area. So Greater Sydney, including Blue Mountains and Wollongong, will remain as red zones for now. There'll be an ongoing review of Greater Sydney, obviously, in terms of mystery cases, ongoing transmission, the level and extent of exposure sites, and the chains of transmission. It's obviously been referred to as a mop-up exercise, and the trend has been going down in terms of new case numbers every day. That's absolutely a positive, but the risk is still there, and so the designation of it as a red zone is appropriate in my view for now. For Greater Brisbane, as you know, the restrictions will change. There'll still be a baseline level of restrictions that are similar to those that were in place in July in Queensland. Masks will still remain mandatory for many indoor settings, so the risk remains. The case who was positive in Brisbane was out and about until the 7th of January, so it's still a relatively short period of time in the exposure for the few hundred close contacts that have been identified to date. There are still close contacts that might be identified. There are other results that need to come through on those close contacts, but a very robust response and a lot of negative tests in close contacts to date. That's all very encouraging, but it is appropriate that we kind of follow the Brisbane lead of it still being an area of risk, and as we know, there's been a designation of it as a hotspot. Other jurisdictions will make their own determinations, but it's my view that it needs to be considered every day, and that we really need to see more negative tests in close contacts play out over the next day or so. Thank you. There has been a case notified in Israel in a child who boarded a flight who was in childcare on the 7th of January in Victoria, in Melbourne, detected on a rapid point of care test on arrival. Rapid point of care tests have variable sensitivity and specificity. It's my suspicion that this is not going to end up being a confirmed positive test. We are following that up with the Israeli authorities. As soon as we can get a determination on a more precise test, we'll provide that information. I do suspect it'll end up not being a true positive case. That said, the childcare centre is closed, and all individuals there are being tested and will need to return a negative result as well. So low risk, but we are taking a super precautionary approach in that individual.
So when the child flew from Melbourne, and where exactly
Flew into Tel Aviv and tested on the 9th of January.
What leads you to believe it's probably not?
Look, I think there are a couple of things. One is that there's absolutely no link to anything with regard to that childcare centre with our existing cases and exposure sites. Rapid point of care tests have been known to turn up as positive when the cases are not indeed true positives. They're different to the PCR nasopharyngeal and pharyngeal swabs that return a result after several hours that are much more accurate, have 99.9% accuracy. So these rapid point of care tests are very useful, but they can turn up a positive result in someone who's not truly a case.
So no one else associated with this child is taking it?
No, absolutely not.
If it did turn out to be positive, that would be very concerning.
Oh, absolutely. We'd need to check all of those contacts, but we have taken the approach anyway of looking at all of those close contacts in the childcare setting.
Is she the only one on the plane that's had that positive result?
Oh, we won't know that. The Israeli authorities would only notify us through the international health regulations with respect to Australian residents.
So that's definitely not counted in our numbers today, or?
No, it wouldn't be counted in our numbers in any case. It's been identified in an international jurisdiction.
Just one on that. In terms of what's your advice for other children, particularly the ones that were in the room with that child?
Look, it's really a case of seeing the testing play out. I would again reaffirm that I think this is going to be a negative test. Children are at extremely low risk of having serious illness. Of course, they can become infected, but the transmissibility in childcare settings is pretty low. And again, my suspicion is this is not a true case.
Just for out of an abundance of caution, I guess, have you contacted or have you traced the contacts of the child, I guess kids who weren't necessarily in the childcare, but other contacts this child might have?
I'm not aware of other close contacts because the family travelled together, but I can come back to you on whether there are other contacts outside of that setting. Look, I think we review every day. There are, as I say, a few hundred close contacts that have been identified. There are others that may well turn up in the next couple of days as further information comes through, FPOS data and public transport data. So we do need to follow through on the testing of all of those close contacts to make sure that they're negative. They're still only initial negative tests. There is a 14-day period of incubation potentially for close contacts. If all of those close contacts turn up negative, that would give me a pretty high degree of confidence that we could, review the setting, the designation of that Greater Brisbane area. Look, it may be earlier than that. I don't think we need to wait for the entire incubation period to play out, but we do need to understand if there are further close contacts that are going to be identified and what that initial test of all of those close contacts turns out to be. My understanding is through Service Victoria is that it's a matter of minutes, so it's just a few minutes to get that permit issued. Look, I think there's always a demand right at the beginning, and I think people need to bear that in mind and have patience with the system. But this is a system that's going to be in it for the long haul, and it'll be a very efficient system going forward. It'll be very agile, and I'm very pleased that the data capture that is inherent in the system means that we can also respond to any changes as required if there are hotspots that turn up in future.
Is there a guarantee that the colours might change from green to red, that there will be an orange period in between so that people can get home from
No, not necessarily. We have to respond to changing circumstances as they appear. As we've seen, an area can go to a very dangerous designation if it's one of these variants of concern. If in a single day there are multiple individuals identified and the origin or source of that transmission is not known, then it could absolutely go to red from a green designation overnight. I can't rule out that possibility.
So should Victorians be travelling interstate, Brett?
Look, I think they should be travelling interstate. We're all in need of seeing family, friends, loved ones, and there are important occasions that people need to get to. What everyone should be aware of is that we're all working to a system whereby we have to protect the health and wellbeing of Victorians and do what's appropriate in order to manage that risk. So if people get caught out, sometimes it's an inconvenience, sometimes it's absolutely tragic. So people need to bear in mind that that's a risk that we are all needing to manage in our lives. The fact that there have been some warnings about regional New South Wales or travel to New South Wales in recent days should be a point to reinforce. There are other areas that can suddenly pop up, but I totally understand people's need to travel interstate, and they need to make that choice for themselves, but they need to recognise there's always a risk that's present.
There are people currently detained in hotel quarantine that haven't been anywhere near Sydney or any of the other New South Wales hotspots. They've driven through, in one case, they've driven through New South Wales to Queensland. Will those people now be released from detention given that New South Wales has been downgraded to amber?
Yeah, so for those who've been in regional New South Wales, they will be given advice as of 5:59 p.m. tonight with instructions about how they can manage their risk ongoing.
So would you expect those people to be let out of hotels?
Yeah, I would.
Have you consulted
On New
with
Year's Eve, regional New South Wales went from, green to red in a matter of hours. How is this system, the one that you introduced today, any different to what was in play on New Year's Eve?
So I guess the real advantage of this system is that those designations in terms of the zone colours can be made on the public health advice, on my advice through my team's input immediately, and it doesn't require new drafting of legislation under the Public Health and Wellbeing Act in order to come into effect. It can essentially be a change made on my advice. It operationalises on the Service Victoria website almost immediately.
In this system, can this...
Yeah, I'm not entirely sure how the grace period will be operationalised, but there will be people who are in transit. They'll need to be managed with an understanding that they've been given a permit under an old system prior to the 559 changeover.
In this system, can there still be no zones?
So I guess the only no zone that there is currently is the Victoria-New South Wales border, where there isn't a permit requirement for the border bubble or the border communities. So they are exempt, if you like, from the permit requirements, but otherwise across Australia the permit system's in place. But the green permit does allow free travel.
Yeah, but if there's no cases in New South Wales, no active cases, haven't been any local acquisitions in 14, 28 days, and I go to Riva for a week for a holiday, I need the government's permission signed off by you to come home.
It's not dissimilar to the WA Good to Go app. This is capturing information about where people are coming from, in what numbers, where they're going to, so that if there is a change in designation, that even applies retrospectively, because the exposures are known to be when someone has been symptomatic or infectious, can apply to an earlier date. And so we'll need to know who's travelled from that date. So even though it might have been green, the data that's captured through this permit system is really critical to understand who's at risk and where they are across Australia.
So you get to gather information about my whereabouts even when there's no virus?
So it is, as I say, no different to WA's model, Tasmania's model, capturing information about where people are moving for the purpose of protecting their health and wellbeing.
Given how quickly the designations can change, just considering the circumstances, if there is a virus, let's say in New South Wales, even if there's one case, would you advise Victorians not to travel to New South Wales?
I think we'll try and come out with advice as soon as possible. All of these circumstances are very individual, and one mystery case with dozens of exposure sites is different to a single case known, all close contacts in quarantine and the like. So I think we'll just try and advise as best and as early as possible under the circumstances.
What would New South Wales need to do to satisfy, I guess, you
So I guess the situation in Sydney continues to unfold. There are grumbling new cases. The things that assure us are obviously if the mystery cases or cases of unknown acquisition have been more than 14 days in the past, if the new cases that turn up are all linked to known cases, are all in quarantine at the time that they're identified, they're all elements that are more reassuring.
Have a rigid, criteria. Do they have to have, fewer than 5 cases, fewer than 5 mystery cases over a 14-day?
No, there aren't really rigid criteria. It's all of those elements that are reviewed continuously, and it does relate to those complex elements about where exposure sites are, how infectious an individual is, how many cases there are, but also the known and unknown acquisition for cases.
Will this permit system only operate under a state of emergency?
I couldn't tell you, maybe the Premier.
For so long as the state of emergency is in place, this permit system will be in place.
So let's do something very beautiful for all the news and thousands of people stuck in the state. If you could describe them very clearly.
There's nothing that can be done to prevent that. If I get public health advice to lock out another part of the country from people from that part of the country travelling to Victoria, I will not hesitate to do that. I will do it in a moment. And that's the stakes are very high here. We have built something that is precious and it needs to be safeguarded. And I make no apology for doing everything I can to keep Victoria safe. The alternative would be to ignore public health advice. We've not done that, and I'm not about to start doing that. And that's why when you are making a judgment about whether you're going to travel to other parts of the country, you have to at least give some thought to the notion that there could be an outbreak, and your plans may well be impacted by that. That has got to be part of your thinking, because it's not normal. We are in a global pandemic. There is no vaccine yet. And until there is a vaccine and until there is appropriate take-up of the vaccine and it is rolled out, then our lives are going to be different. They're going to be COVID normal, not normal. And whilst you may be very fortunate and be able to travel to another part of the country, there's no outbreak, there are no cases, and you can have as close to a normal experience as possible, there will always be that risk. And I just ask people to factor that in. I know that's very frustrating, but there's no getting around that unless and until we have a sufficient percentage of the overall Australian public having had the jab.
Have you consulted with the federal government on this permit system, Premier?
No.
Is there a need to?
No.
If there are different systems in different states, why not look for some
Well,
national?
we saw on Friday coming out of National Cabinet a decision announced by the Prime Minister, a National Cabinet decision in terms of Brisbane. Some went beyond that. But I think the notion that people are not working well together, I just don't think that's right. I think we are all working together to achieve the same thing, and that is to keep everybody safe until we finish up with the vaccine rolled out, and hopefully that's only a matter of months away. It's not onerous at all. Go on the Services Victoria website, get a permit. If you're from a green zone, you can travel. If you're from an orange zone, you can travel as well. There may be different conditions, and if you're from a red zone, you can't. Oh well, look, I don't think that I don't think there's anything wrong with doing everything we possibly can to keep our state safe, and for us to play our part as part of the overall nation to keep this virus out. That is a really important part of our job. That's exactly what we're doing. And then Rachel.
Is there less police there? Are you going to take police away from there?
No, the border will still be patrolled. The border will still be patrolled, and Victoria Police are doing a very good job. It's very challenging work, and we thank them. We're very grateful to them for the work that they're doing. And again, Victoria Police have had a lot to do these last 12 months or so, and they've done a fantastic job playing their part to keep all of us safe. Rachel.
Premier, Western Australian Premier Mark McGowan called on New South Wales to fall in line with other states and territories and join the rest of the country in pursuing the elimination of COVID-19. Firstly, do you agree with him that we are pursuing elimination? And secondly, do you agree that New South Wales is out of step with the rest of the nation?
I'm not here to be a commentator on other states. What I will say, though, just to be completely clear with everybody, we are not looking to wipe this thing out. We have to live with it, and that's exactly what we've been doing these last few weeks. where the virus got out of hotel quarantine in Sydney, then made its way to Melbourne, and we've not locked the place down. We've put in place absolutely top level contact tracing. We've seen tens of thousands, more than 100,000 people come and get tested. This is with us until we get enough of the community through that important process where the vaccine will be rolled out. It was something that was discussed at National Cabinet on Friday. I know health ministers are working very hard together on that. We're all part of this. It's not a matter of trying to eradicate the virus. It is the fact we have to live with it, and that means sometimes trips interstate will be disrupted. Sometimes people will have to quarantine, they'll have to isolate, they'll have to go and get tested because they were at a venue where somebody was there also with them, unbeknownst to them, and had the virus, or was a close contact of someone who had the virus. All of these things are now part of our daily life, and they will be with us unless and until we finish up with the enough Australians having gone through that process. Hopefully that's only months off, and we can certainly by the middle of the year have made a real dent in that, and that will fundamentally change things.
So is London going wrong in saying that there are 5 states?
Rachel,
There are 3 pursuing elimination
well, I'm not. Yeah, I haven't seen his comments. You've read some comments to me. I'd need to see the full context. I'd need to see what he said. But I'm being really clear with you. As a member of the National Cabinet, we all of us are pursuing an aggressive suppression strategy, or an active suppression strategy, where if you finish up with cases, you crack down on those cases as hard as you possibly can. That's what's worked here. It's what's working in other parts of the country.
If there's a Victorian who's, for example, a casual worker and they've travelled interstate, they find themselves on the wrong side of the border because Victoria has designated a red zone. Will
Yes.
there be any, I guess, any salary help or, I guess, any financial help?
I need to come back to you in relation to the specific example that you've given, but you've just reminded me to make another point. I've written to the PM and asked them the federal government to include in the casual worker payment, that $1,500 payment, those people who don't necessarily qualify at the moment. They haven't got it, they're not a close contact, but because of the fact they've been in another part of the country, they're having to isolate. If you don't have leave and you're a casual worker and you're in those circumstances, you'll be eligible for that payment. Those payments are made by the Commonwealth, and we think that's a really important recognition. We don't want people having to go to work and having to choose between going to work to feed their kids rather than playing their part and doing what's required from a COVID-19 point of view. So they wouldn't be eligible, they're not now, but I've asked the Prime Minister to change that criteria and make sure those people get paid. On the specific example you've given me, let me ponder that and we'll come back to you with an answer.
Are you confident that he will change the criteria?
I am, yes, I am, yes. Provided we don't all melt here, well, yes, I am confident he will change those the criteria, and we'll see people who are in those circumstances getting paid so that they're not away from work, or indeed having to go to work because they simply can't afford to adhere with the orders that the Chief Health Officer has made.
There are people in hotel quarantine, so just really quick follow-up.
Sure.
People who might be stuck interstate in context of
Yeah, I think that's Samaya's question, and I'm going to chase that up for you.
There were people in hotel quarantine, one specifically a woman who landed in Melbourne last night. She left New South Wales before the border shut, but because she'd gone from there to Queensland and
Yes.
arrived in Melbourne, she
Yes.
was in hotel quarantine. How long will it take for her, or people in those situations for their cases to review? How long will they sit in hotel quarantine and wait?
I think we'll look at those cases as quickly as we possibly can and get those people clarity as soon as we possibly can. It does take a little bit of time, but we won't waste any time doing that. We know how important that is.
New South Wales Police, they've charged a 53-year-old man today with allegedly making threats to kill you via email. Are you able to shed any light?
That's
Did you
a matter that's before the courts, as I understand it, and it's not my habit to be commenting on matters that are before the courts, nor do I comment on matters of security.
With the fines you mentioned,
Yes.
was there no legal capacity to fine people who try to come over for contrary rules?
No, there was. This is a new offence, and it has a higher amount, so it's up almost $5,000. That's not a decision that we make lightly. That's not a fine that would be issued easily. But that's how serious this is. We've got a system, we're moving to it. It's a simple, easy, practical way of doing this, or as much as you ever can be. And on that basis, if you're not following those rules, then you do face a $5,000 fine. That's a very significant a very significant penalty, but I really do hope we don't have to issue any of those fines because people ought to take this seriously and ought to do the right thing by themselves and by every single Victorian.
And you touched on this, but how is it going to be policed? Will police need to be on the border?
There'll be police on the border, there'll be authorised officers at our air and sea ports to make sure that everyone is, only those who've got a permit and are travelling as they should be, are in fact entering our state.
The Victorians who are due to end in March, should it be continued as it is, or do you think with border closures potentially still on the cards, states that do close their borders should carry more?
No, that's JobKeeper, JobSeeker, they're entirely matters for the federal government.
The Victorians have been isolating since Friday. Are they
Yes.
free to leave isolation since 6 o'clock tonight?
I might ask Brett to speak to this because there will be a number of people caught up by this.
It really will depend on the designation of some of those individuals who've been in quarantine, but for those individuals who've been in what's been rural or regional New South Wales as a red zone, turned into an orange zone, yes, they will be free to leave quarantine. And Brisbane, yes, I think we're looking at the same, but with a test result being required before release.
So that's at 6 p.m. tonight.
That's right.
The Brisbane BBL team, they're due to play the Renegades in Melbourne on Thursday night. They're a basketball team. Will they be allowed to come to Melbourne?
Not under current restrictions, because I know they've travelled through a red zone in terms of Greater Brisbane. But again, if the designation for Greater Brisbane changes in the intervening period, there is a possibility.
I know this is still a couple of months away. Can I follow up on that? The AFL season, presumably the teams are going to be travelling between states. Do you have any idea what that might look like?
Not really. Look, it'll be as challenging as last year in some respects because there are continued constraints in various parts of the country. But I think our permit system will give a certain ease operationally to movement in and out of Victoria for AFL player purposes.
Just on the Brisbane, do people have to test there before they return, or come here?
I'll come back to you on the testing requirements.
Similar traffic light system for overseas arrivals, certain places would be red, so UK or...
Yeah, look, I think it's worth exploring. We've obviously got a bubble arrangement with New Zealand. There are other international legal instruments that are at play in that, so we need to look into that a bit more before it can automatically become part of the permit system, I think.
And given the new permit system, would you arrange a border bubble between South Australian and Victorian border communities?
Not at present. That's not the desire of South Australia in that regard. Part of the issue is, again, the data capture. South Australia wants to make sure that they're aware of everyone who's moving across the border. They would like the same for Victorians who are moving across. But again, the administrative burden of the permit system should be really minimal. And for those border communities, it's a green zone. They can apply for the permit. It'll apply for several days for them to move across freely.
I know you don't comment on other chief health officers' directions, but are you disappointed that Brisbane has allowed, or I guess the chief health officer there has allowed Brisbane to sort of get out of their 3-day lockdown?
No. Look, it was an appropriate course of action to take for the very first community case of a concerning variant, and I think it's that breathing space that was required to identify all of those close contacts, make sure they're in quarantine.
If you're confident Queensland authorities have been able to identify all of the contacts of this particular woman and been able to, I guess, contain that outbreak, why aren't you confident allowing Victorians who are stuck in Brisbane to come back?
I think there's still some time to play out for those close contacts in Brisbane. There are hundreds of them. Many of them have tested negative. That's a good sign. But you can develop illness up to 14 days after exposure. And the infectious individual or the confirmed case was in the community until the 7th of January. So, some of these baseline restrictions that will continue in Brisbane are on that very basis. They'll be in place until the 22nd of January because that's a full incubation period for the virus. And so we could still see a case over the next 10 days or so.
Until you're satisfied that enough Australians have had a vaccine, Victorians will need a permit.
I think that's right. The risk will remain in the early administration of vaccination to hotel quarantine staff to our frontline health workers, our aged care residents and aged care workers. That protects those critical workforces and individuals, but it does not mitigate against the possibility of a widespread outbreak in other cohorts or populations. That could still play out in Australia right up until the time that we've got sufficient vaccination-based immunity to really minimise the risk of significant outbreaks.
Just quickly on the Australian Open, are you confident that everything's in place for that to go ahead? I think players are supposed to be arriving from Thursday.
Yeah, that's right. Having reviewed 353 pages of procedural details in the last couple of days, I am. Very detailed procedures, very robust. They've gone through layers and layers of review. There are layers and layers of quarantine bubbles within the entire cohort. So I'm confident that those procedures will be really robust to manage the risk. I do expect that there'll be some individuals who turn up positive. The global situation is that those who are coming into quarantine from international destinations are becoming cases at a rate of 1%. And so with hundreds of individuals arriving, there will be some positive cases expected.
There are probably a number of limits be lifted anytime soon, given that black rock clusters have been under control and you haven't given us an update on potentially in Chadstone. So those restrictions that we put in place for those two scenarios will be lifted.
Look, I think we're always reviewing these, but as has been said many times, and the chatter around masks has quietened down because it is an insurance policy. You can have 60 days of no transmission and then you can suddenly see yourself faced with a significant outbreak, and everyone is reassured by the fact that those cases are wearing masks when they're infectious and they're identified after the fact. So as an insurance policy, wearing masks indoors is a useful exercise. It's now in place in Brisbane, it's now in place in Greater Sydney, and it's very useful. So yes, we'll continue to review that, but as an ongoing insurance policy, especially in indoor settings with high risk of amplification, we should consider it a very useful insurance policy.
There are a number of Victorian families in Brisbane who are there with their school-age children. In order for them to complete their 14 days of quarantine, they want to return by Wednesday. Are you confident that you'll be able to go through all those exemptions and allow them to come back into Melbourne?
Look, the exemptions process is being ramped up, but there have been literally thousands of exemptions. There's still a number to work through. The change in the designation of Greater Brisbane would be the easiest process, but we have to be confident that change in designation can occur.
And is that exemption process that you were going through over the weekend, is it the same criteria moving forward given the traffic light system you have?
So for exemptions, essentially those criteria are still the criteria under consideration. All right, thank you.
We should just remind everybody that today is a severe fire danger day in the Mallee, Wimmera and Northern Country districts. There's a total fire ban in place there. And of course there's significant fire danger in the southwest, north central and central districts as well. So everyone please be aware of your circumstances. This is obviously a very hot day. Fire safety is critical not just in those parts of the state but everywhere. Please be aware of your circumstances and get advice about what's happening in the community you are travelling to. Knowing what's going on is critical. You can't make good decisions if you don't have the very best and latest information. If there's no other matters, thank you very much.